American philosopher Alan Watts says, "The problem is not depression itself, but our depression about being depressed." These words summarize the suffering of millions around the world who live with depression without realizing the true nature of what they're going through. Welcome to today's video, where we'll talk about a topic that affects 1 in 5 people at some point in their lives. Depression is not just passing sadness. It's a complex mental condition that can change your entire outlook on life. Today we'll discover together the real signs of depression and how to distinguish it from normal sadness. Before we talk about the signs, let's understand what depression is. Many people confuse sadness with depression, but there's a fundamental difference between them. Sadness is a natural emotion that comes in response to a specific situation, losing a loved one, disappointment, or a difficult challenge. Sadness usually fades with time, and you find yourself able to enjoy other moments despite the pain. Depression, however, is much deeper than that. It's a mental disorder that affects brain chemistry and lasts for weeks, months, or even years. Depression steals from you the ability to feel joy, even in situations that previously made you happy. Depression affects more than 280 million people worldwide and is one of the leading causes of disability. But the bigger problem is that many do not know they have it or are ashamed to admit it. Depression is not weakness, and it's not something you can get rid of with just positive thinking. It's a real illness that needs understanding, support, and treatment. The first and most obvious sign is a feeling of deep sadness that doesn't go away. But what distinguishes depression from sadness is that it's persistent, daily, almost all day, for consecutive weeks. Some people don't feel sadness, but complete emptiness, as if something inside them has been turned off. You feel like you're living behind thick glass, watching life pass around you, but unable to truly participate in it. Remember those things you used to love? Hobbies, friends, even family? In depression, these things lose their luster. You become indifferent to what used to excite you. This is what doctors call anhedonia, the inability to feel pleasure. Even simple things like eating your favorite food or watching a movie become heavy, meaningless tasks. Depression makes you feel useless, like you're a burden on those around you. You start constantly beating yourself up and blaming yourself for things beyond your control. The dangerous thing here is that these thoughts seem logical in your depressed mind. You believe them completely, even though reality may be completely different. In severe cases, thoughts about death or self-harm may appear. You might start thinking that the world would be better without you, or that death is the only solution to end the pain. If you're having these thoughts, it's absolutely crucial that you seek help immediately. This is not a sign of weakness, but that you need specialized support. Depression often comes accompanied by anxiety. You feel constantly tense, worry about everything, and can't stop the spiral of negative thoughts in your mind. What surprises many is that depression isn't just a mental condition. It has clear physical effects. 1. Sleep disturbances. You may find it difficult to sleep despite extreme exhaustion or wake up in the early hours unable to return to sleep. Some experience the opposite, excessive sleeping, where the bed becomes a refuge to escape reality. 2. Changes in appetite and weight. Some depressed people lose their appetite completely, while others turn to food as a way to deal with emotions. You may notice a significant change in your weight without trying to do so intentionally. 3. Constant fatigue and exhaustion. You feel tired all the time, even after rest. The simplest tasks seem to require enormous effort. Showering, cooking, even replying to a text message becomes exhausting. 4. Chronic physical pain. Recurring headaches, back pain, stomach problems, all can be related to depression. Mind and body are closely connected, and psychological pain often manifests as physical pain. 5. Slowed movement and thinking. You may notice that your movements have become slower, your speech sluggish, and your thinking confused. You need more time to process information and make decisions. 1. Social withdrawal. You start avoiding people, even the closest ones. Answering calls or messages becomes a burden, and leaving the house seems impossible. You prefer isolation, even though it increases your feeling of loneliness. 2. Neglecting personal hygiene and appearance. When you lose interest in yourself, you may stop taking care of your personal hygiene. Simple things like brushing your teeth or changing clothes become heavy tasks. 3. Difficulty concentrating and making decisions. Your mind is occupied with negative thoughts to the point where you can't concentrate on anything else. Reading one page of a book becomes impossible, and making the simplest decisions makes you feel confused. 4. Severe procrastination and delay. You postpone everything, even important matters, not out of laziness, but because you feel unable to accomplish anything properly. 5. Irritability and quick temper. You may find yourself quick to anger over the slightest reasons. Patience becomes non-existent, and you react exaggeratedly to ordinary situations. Not all depression is the same. There are different types you should know about. Major depression. This is the most severe type, where most of the symptoms we mentioned appear clearly and for a long time. It significantly affects your ability to work and interact socially. Persistent depression, dysthymia. Less severe but lasts longer, at least 2 years. You feel depressed most days, but not with the severity that prevents you from continuing your daily life. Seasonal depression appears at certain times of the year, usually in winter when daylight hours decrease. It disappears with the arrival of spring and summer. Postpartum depression. Some mothers suffer from this after childbirth, and it's more than just baby blues. It needs specialized medical care. Bipolar disorder includes periods of depression alternating with periods of mania or excessive activity. This type needs special treatment and careful monitoring. The important question: when does normal sadness turn into depression that needs treatment? If symptoms persist for more than 2 weeks and are affecting your daily life, your work, relationships, ability to enjoy life, this is the right time to seek help. Don't wait until you hit rock bottom. Depression, like any other illness, the earlier it's dealt with, the better the results. Seeking help is not weakness, but strength and courage. It takes courage to admit you need support, and this is the first step toward recovery. You can start by talking to someone you trust, a friend, family member, or spiritual guide. But it's also important to consult a specialist, a psychiatrist or psychotherapist, who can provide proper diagnosis and treatment. The good news is that depression is treatable, and there are multiple options that have proven effective. Psychotherapy, also known as talk therapy. The most common type is cognitive behavioral therapy, which helps you identify negative thoughts and change them, and develop skills to deal with depression. Medication, antidepressants help correct chemical imbalances in the brain. There are many types, and the doctor chooses what's most suitable for your condition. You may need to try more than one type until you find the right medication. Very important, don't stop taking medication suddenly, even if you feel better. Always consult your doctor. Lifestyle changes. Although they don't treat depression alone, they help significantly. Regular exercise stimulates the release of mood-improving chemicals, adequate and regular sleep. Healthy, balanced nutrition, spending time in nature and sunlight. Relaxation and meditation techniques, social support. Staying in touch with loved ones, joining support groups where you meet people going through the same experience. Sharing your feelings with those who understand you lightens the burden. If you have someone close who suffers from depression, here's how you can help. Listen without judgment. Give them a safe space to express their feelings without fear of criticism or superficial advice. Sometimes just genuine listening makes a big difference. Avoid hurtful phrases. Don't say things like, "just think positively," or there are people worse off than you. These phrases, despite good intentions, make the depressed person feel misunderstood and increase their isolation. Be patient. Recovery from depression takes time. The person won't improve overnight. Your continued support even on difficult days means a lot. Help with practical steps. Sometimes the depressed person doesn't have energy to do simple things. Helping them book a doctor's appointment, prepare a meal, or just sit with them can be great support. Take care of yourself. 2. Helping a depressed person can be emotionally exhausting. Make sure you're taking care of your mental health too, so you can continue providing support. Conclusion, 2 minutes. Depression is not the end of the road, but a challenge that can be overcome. Thousands recover every day and return to lives full of meaning and joy. If you're suffering from depression, remember you're not alone. Millions of people around the world are going through the same experience, and there is real hope for recovery. The first step is acknowledging the problem and seeking help. This may seem difficult now, but you deserve to feel happy again. Let's return to Alan Watts' quote that we started with. Sometimes the problem is not depression itself, but how we deal with it. When we accept that we need help and get rid of the stigma associated with mental illness, we begin the real journey of recovery. Your life matters, your feelings are real, and you deserve support and treatment. Don't let depression steal the beauty of life from you. Thank you for watching. If you liked the video, don't forget to subscribe to the channel and activate the bell to receive everything new. We welcome your comments and questions below. Be well and take care of yourselves and those around you.